So today our guest is Dr. Bhasin. He's going to be talking about seed oils, how kids are getting liver disease because of processed foods, and how a large French fry has the same amount of toxins as 28 cigarettes. This is a very insightful episode. Stay tuned and enjoy. Hello everyone. Today we have Dr. Bhasin. He's a radiologist and very passionate about food and nutrition and has been going on depth on this for a little while. I met him a few weeks ago at a health fair. We had good discussions and he has a lot to talk about. I'll let him introduce himself right now.
Hey Karthik, thanks for having me on your podcast. So Swarnjit Bhasin, I'm a radiologist, practice for about 15 years now in private practice, Kaiser, Northern California. And, over the years, what I've seen is, just sitting behind a computer, basically just letting you know what a radiologist does. Some people don't know what a radiologist does. We're the ones that usually look at the images. So if you're going to go into your doctor and get an X-ray or a CT scan or an MRI or an ultrasound, it's usually a technician that will come and take you back. They'll do the examination and then they send it off to the radiologist. So the radiologists are the specialists that read the scans. So we look at the images and interpret them. So through my 15 years of practice, I've been seeing that, our rates of obesity has been gradually getting worse over time. And then a couple of things that really bothered me sitting in the on the computer and reading these scans was I was seeing cancers younger and younger patients. Specifically, breast and rectal cancers were showing up more in patients in their 20s and 30s. So this has always puzzled me throughout my career. And another thing that really strikes me is non-alcoholic fatty liver disease. So this is where there's fat buildup in the liver itself. Usually whenever you have like a liver function test and if you see the markers are a little bit elevated, your doctor might order like an ultrasound examination to confirm, and then we can actually see the fat deposit on ultrasound and CT images. So routinely I see patients coming in through the ER for something else, for abdominal pain, but I'm routinely diagnosing non-alcoholic fatty liver disease as an incidental finding. And this is where I just did a deep dive last year, 2022, and I really, I think I learned stuff that I should have learned in medical school. So I'm really glad you're pursuing this and you're really inquisitive and trying to learn. And I learned how we can really help all these things from a nutritional standpoint. And I think this is where in our medical field, I think that is a little bit lacking in school, is doctors don't really get any nutritional education. So this is where I came up with, how can we do a healthcare message to get the word out on how we can really reverse non-alcoholic fatty liver disease and also prevent cancer in young patients through 3 simple metabolic steps. And that's what I've started this year, beginning of this year. I've set up a CME and I've done some talks in some of the Kaisers, and I'm going to pursue that and really try to help make it a very simple message for all in the community and amongst the hospital staff itself.
Okay. Thank you for that intro. And yeah, like you said, all the rates of cancer, I personally know 2 close friends that have been my age that have passed away from cancer throughout my lifetime already. And it just makes me more inquisitive of like, why is this happening so early when it was supposed to be a disease that older people get? And then you're talking about how these non-alcoholic fatty livers, like, didn't you say you saw someone with a 13-year-old child with a non-alcoholic fatty liver once? And
yeah, sorry to hear, your people that that died early at a young age with cancer. And yeah, this is where non-alcoholic fatty liver disease, I think a couple of months ago, I diagnosed someone, the kid was 10 years old. So this is affects everyone. Adults, we see it mostly 30s and 40s, but we're even seeing it in kids as young as 10 years old. So we really need some kind of action, because Non-alcoholic fatty liver disease. Another thing about this disease is there is no pharmacotherapy for this. So there's no medication that you can utilize to treat this. And that's another thing that I really, as a radiologist, I'm seeing this. I can diagnose it, but there's no medication to treat it. So I actually took it on myself that why don't we implement the 3 simple steps that I came up with? Why don't I just prescribe that on my report itself? Because in California, patients are able to see their reports. So this gives a chance for the patients to see the diagnosis, and it gives them 3 simple steps that they can take to really reverse the non-alcoholic fatty liver disease. So I'm actually starting to put that in my reports myself.
Oh, wow. So you're reversing these as well?
Yeah. So I'm doing diagnosis and a little bit of treatment at the same time. Usually radiologists do not prescribe medications. We don't really write prescriptions. But this is my simple prescription for 3 simple steps whenever I do see non-alcoholic fatty liver disease.
Okay. So let's get into your 3 simple steps. If you could list them out, and then we can go topic by topic and deep dive into each one.
Perfect. So, I thought long and hard about this as I was learning all the information last year, and I was really churning it in my head. How can I make this as simple as possible? And these are the 3 simple steps that I came up with. And this I would call this is healthcare marketing. My healthcare marketing, because I think big food has a big budget to market all of their products, all of their stuff that you see in the middle of the grocery stores. So this is my healthcare marketing, and the first step is to avoid toxic seed and vegetable oils. The second step is to eat a diet low in processed carbs and sugars that uses healthy sources of fat. And then the last step is practice intermittent fasting, built on a solid foundation of time-restricted eating. So those are the 3 simple steps.
Okay. So let's go on to the first seed oils one, because I know this is a hot topic, hot debate that everyone's talking about out there right now. On the health trends, it's the main thing people are talking about. And it's confusing because I've seen the videos on how they make the seed oils. Seems very toxic. But then on the other hand, when you're comparing the nutritional facts of, let's say, butter or ghee versus a canola oil, or maybe some other processed seed oil that has way less fat, way less calories, could you explain why exactly seed oils are causing the damage and how?
So this is where, I would highly encourage everyone to go onto YouTube and just put in how is canola oil made. And there's a 5-minute video that comes up. So you really have to, I think that is the eye-opening moment. When you see that video, you see how they're making that vegetable seed oil. When you see the processing where they're squeezing the seeds, then they wash it with some chemicals, then they process it, and then they have to deodorize it, and then they have to bleach it. This is not a natural product. And this is where, sad to say, we really, as physicians, we really need to understand the money that is behind our food system to advocate for the right diet for our patients. And this is where just seeing where the incentives were really led me to see what is going on with the seed and vegetable oils. And this is where the industry in the US is a $100 billion industry. So it is for profit. So they are going to promote these. But as healthcare provider, I would advocate for the simple fats that have been used for thousands of years. And there's a Journal of American College of Cardiology that have said, there's nothing worrisome about saturated fats. This is recent data. So I think we need to really look at the most recent science and not fear the saturated fats that are naturally occurring. And this is where whenever I say, do not use, I'm just going to name them off. I think it's worthwhile for everyone to hear what the 8 vegetable oils to avoid are. It's canola, corn, cottonseed, soy, sunflower, safflower, grapeseed, and rice bran. So these are the ones really to avoid. And for each one of the three steps, I actually had an expert come in and talk to our colleagues in the Kaiser that I'm at. So each one was, with the first step, I had Dr. Kate Shanahan come in and speak. She's a great, she's got a biochemistry background, and she's been talking about this. So if you wanted to get some more details, I think that's someone that I would recommend to review. She's got a lot of great information. She dives deep into this. And then this is where, once we tell folks not to use, really need to clarify the message and tell them what to use. So the simple 6 that I like to always tell folks, it's olive oil, avocado oil, coconut oil, butter, clarified butter, which is ghee, and also beef tallow. So these are some of the simple 6. There's more healthy fats out there as well. But this is just to get an idea like what to avoid and what we should be using. And the toxicologists have done studies on these vegetable oils. And Dr. Kate Shanahan, when she came out, she said the toxicologists reviewed this. Large fries at any fast food chain, the toxins are equivalent to 28 cigarettes. So this is where we are actually inadvertently smoking whenever we go out to eat at any fast food chain. So this is information that we really need to get out. And I think if you were aware of this, and if I'm aware of this, I would probably hesitate the next time I go. I might try to find a different venue that might make their fries in some healthier oils.
So just to clarify, this is basically any food that's fried and cooked within the vegetable oils, right? It's not the fries themselves, right?
And usually the fast food places, their fries itself has multiple ingredients in the double digits. So it's not just potato, because they manufacture those things to stay fresh. Even if you're getting it delivered 30 minutes to 1 hour later, their goal is to keep it crispy and edible and get the same taste that you would in the restaurant. So their incentive is not your health. And the vegetable oil is the really big thing that causes the harm. And this is where I would say the toxicology, I think they're screaming at the top of their lungs. I think MDs have different meetings than the toxicologists. We're not getting the information across, but I think we should start listening to some of our colleagues there.
Okay. So back at, I think it was in the 70s or 60s, I know McDonald's used to cook their fries in beef tallow and beef fat. And then there was a whole lawsuit because they didn't advertise it, and people who were vegetarian were offended, so they transitioned to vegetable oils. So my question would be, if those fries are being cooked within beef tallow, and let's say back then they weren't as processed, let's just regular fries, would that be a much healthier version of fries than what we're eating nowadays?
Yes, definitely. The oil that it's fried in really makes a big difference. And this is where you can make fries at home. If you had some avocado oil, it's got a high heating point. You can go ahead and fry some potatoes in there, make some fries at home. I know there's restaurants where I work. There's a local butcher. They use beef tallow for their fries. I know I've just done some digging. I think Five Guys does. They use refined peanut oil, which is in the middle. It's not the healthiest, but it's not as bad as some of these seed and vegetable oils. So in the middle. But the fried stuff really has to, we have to cut that down. And once we know that, I think we can really take action. And this is the trend. I've in my presentation, I show CDC maps of diabetes and obesity in the US. And I think everyone's seen those maps.
Yeah.
Over the years, it's just getting darker and darker and worse. So there's something that we're not doing right. And this is highly underappreciated. And I think this is a really big aspect where you should really use fats, because all of the cells in our body use fat, brain uses fat. So I would really advocate putting healthy fats in your diet, but at the same time eliminating some of these toxic seed and vegetable oils. And yeah, after seeing all the data and some of the video how it's made, it's not controversial at all to me.
Okay, good to know. Thank you for that. A little side deviation from that. Let's say this obesity epidemic, people and fast food restaurants are using more of that healthy fats and they get off all the seed oils. Do you think there would be a decrease in the obesity rates, or do you think there's still a bigger problem to be unfolded?
So I think this is one big one out of the two big factors in what's leading to the obesity epidemic. So I think this would really help turn the tide. I know there's a big fast food chain. I won't name the specifics, but there's two restaurants in New York. They're actually experimenting with switching over from the seed and vegetable oils to a healthier oil. So I think as consumers, once we know this and we start asking for healthier oils, and that's what we really need to do, make the members and public aware. And when the public is aware, when it's out there, the message, and when we go to if you go to a local restaurant, I would ask them, what are they using for their frying? And if it's a local restaurant, they would be more than happy to switch over to a healthy fat. You might have to pay a little bit more, but it's really worthwhile for your health. But I'm glad to see that even the big fast food chains are starting to experiment and starting to think, and hopefully the consumers are asking for some changes.
Okay, good. And I think that leads into your second step, which you were talking about, getting off the refined carbs, the processed foods. Could you expand on why exactly we need to get off that? I know everyone's like, oh, processed foods are bad, but what's the specific reason behind why processed foods are harming us?
So this is where, we always say low carbs. If you look at blood insulin response to the different macronutrients, I have one in my trifold we'll show later. The carbohydrate, it's a huge peak. Protein is in the middle, and then fat is really almost like a flat line. And I think the root cause that we're tackling for all of these things, the 3 steps that I came up with, the root cause is insulin resistance. So in healthcare, we need to really bring this to the forefront. That insulin resistance is what we're tackling. And 93% of Americans have some degree of insulin resistance. There's a Tufts paper that was put out there.
93%?
93% of Americans have some form of insulin resistance, and they're not cardiometabolically healthy. So only 7% are really healthy, meaning they have a normal blood pressure, blood glucose, and a waist without medication is what qualifies for being cardiometabolically healthy. So 93% of the people we can really help. And what's really affected our diet is the changing over to the ultra processed foods. So this is where, more processing you do, more steps, it really changes the food. And when you eat it, actually your body doesn't recognize these agents. It doesn't know what to do with it. So it actually is throwing off your hormones. It's really causing you to build more insulin resistance. And this is where, for the second step, I usually tell patients that I see in my clinic, I tell them, if you want to avoid the ultra processed foods, what you do is you go to the grocery store. I think you've probably heard this before too. You want to stick to the outside. That's where the fruits, vegetables, meat, dairy, the really single ingredient foods are. I would say 90 to 95% of the stuff in the middle of the supermarket, sad to say, they're addictive substances, not even food. So those products in the middle of the grocery store, they're filled with the vegetable oils and a lot of sugar and high fructose corn syrup. That's the other thing that is really causing us harm. So we really need to call out these agents, not the healthy fats. And when they're filled with this, they have a scientist in a lab that is creating this food that's in the middle of the grocery store. So they're paying someone that's got a really good background in chemistry and stuff, and they can come up with this, how do we stimulate chemical reaction in this person's brain? And then they have a marketing team. They have a marketing team that creates the package on the outside. So if you take an overview look at the grocery store, the stuff in the middle, it's so shiny and bright. It's very attractive. All the cereal boxes, it's calling for you. But this is where we really have to understand. And I think I've come to realize that this year, just talking about the subject, the 3 steps, that we are really fighting an addiction model. We're fighting an addiction model to food. We need to call it out. We need to get the message out. And next time you go to the grocery store, when you go through the aisles, be careful. That stuff is there, engineered to get you to keep coming back for more. Stick to the outside, and that will really make a big difference to your health. And this is where, when you're eating fries and soda at a fast food chain, your brain never gets a signal that you're full. So you tend to actually overeat. But when you're eating real food, the single ingredient foods, you'll get the signal right away that, oh, I'm full, I should stop eating. So when you're doing that, you're actually gonna moderate your calorie intake itself. And that really makes a big difference.
So it's like a double.
The soda and the juices, the liquid calories, I would say they must go. I mean, you can have it once in a while as a treat, but the big gulps on the way into work or way back from work, they really have to stop.
Yeah. So on that question, we talked about the processed carbs and processed foods, but let's say someone's a vegetarian or someone really likes their carbs. Are you opposed, according to the data, of people just consuming carbs like as a majority of their food? Is that a problem you see? Should they be cutting back on those whole carbs as well?
So this is where, the 3 steps that I've labeled, I would say it accommodates all different diets. So I don't specify any kind of, vegetarian or carnivore or keto or anything. These 3 principles you can accommodate with any diet. But even if you're a vegetarian, I would say, you still want to cut back your carbs and keep it to a lower level and substitute more of the proteins and the healthy fats in there. And then we all of us react differently to carbs, and our insulin resistance is a different level. So unless we measure that, I think you really don't know what kind of response you're going to have. So this is where I think the future of medicine looks good. I think this continuous glucose monitors, they show a lot of promise. They'll let folks try on a CGM for maybe a month in the near future, and they can see how they respond to they're eating a rice, how they respond to that. If it's an Indian person they're eating chapati, how does that rice compare to the chapati? Are they better off doing one versus the other? And I think this will really make a big difference. Okay. But till we get to that level, with the 3 steps, I also included like 3 lab tests to do in order to check on metabolic health. Maybe after we discuss the 3 steps, I just mention those.
Yeah, we can get this. One quick thing for the people watching who don't know what insulin resistance is, could you do a brief explanation and why it's bad?
So what happens is whenever we eat carbohydrates, our insulin response is going to be high to clear off the glucose that's in the bloodstream. Again, with protein, you're going to get a medium peak, and then with fats, you're going to get a lower peak. So normally, your body will respond to these in similar manner. But what happens is if you're loading your body with a lot of carbohydrates, you're drinking soda, you're going out and eating fries all the time, the fast food chains, what happens is your body will stimulate more and more insulin just to try to keep that sugar level to the low, on the lower side. So what happens is folks that are pre-diabetic, their insulin levels will be increased for 5 to 10 years before their glucose levels start rising. So this is where up to 100 million Americans in the US are pre-diabetic. So 1 in 3 Americans is pre-diabetic right now. And 8 out of 10 of those don't know they're pre-diabetic. So there's a lot that we can do to really pick up those folks that are pumping more insulin into their blood to get their glucose down compared to what a normal person would respond. But they're able to maintain the sugars, the sugar, you get your blood work done and the sugar level will be fine. But their insulin level is actually slowly starting to rise. And this is what insulin resistance is, just hyperinsulinemia. So you have overabundance of insulin in your bloodstream just to try to keep your blood sugar down. And that really is the root problem. And this ties into, we talked about the cancers in the young patients. The insulin resistance, what happens is when you have extra glucose circulating through your bloodstream, cancers and precancer cells love glucose. There's a study in radiology, it's called the FDG PET. What we do is in our cancer patients, and we're trying to find out exactly where the tumor is and if there's any spread of the tumor throughout the body. So we take glucose and we radio label that glucose, and then we inject it into the patients. And where does the radio tracer and the glucose go? It goes to the cancer cells. So this really shows that sugar and our insulin resistance is all linked. And there's a lot of data and studies showing the same thing. That insulin resistance is the root cause of all these things. So even though you might be working on the fatty liver, you're actually helping prevent cancer and also prevent dementia. Dementia is also linked to insulin resistance as well.
Interesting. Okay. So for those folks that are, hearing this out and they're like, I want to make a change off of their really processed food diets, what do you recommend to those type of patients to wean off? Like, do you say slowly wean off, make drastic changes? How do you advise them for that?
So this is where, yes, definitely take it in a stepwise manner. Americans are eating 60 to 70% of our calories from ultra processed foods. So this is where we're eating that much from the center of the grocery store. So even if we can cut that in half, the ultra processed foods, and shop more at the periphery, we're going to make a big difference. We're going to make a really big difference. Sugar, cut it down. I'm not telling you to go to zero. You can still have your soda once in a while, but we really need to work towards cutting it down till you get into optimal metabolic health. And this is where maybe you can find the 3 lab works that I usually recommend, and we can cover the intermittent fasting at the end. So the three lab tests that I recommend for checking under the hood, right? We're all learning 93% of Americans are insulin resistant. How do we find out if we are insulin resistant? We really need to check under the hood, right? So this is the way. The first one is a triglyceride to HDL ratio. So what you're going to do is you're going to go to your doctor and you're going to ask for a fasting cholesterol panel. Okay. You might have had one done recently. You can go take a look at the numbers, pull up the numbers. What you're going to do is you're going to take the triglycerides at the top. You're going to divide it by the HDL. So you're going to do that, and you're going to come up with the ratio. So what you want to do is you're aiming for number under 2.5. is your goal.
Mm-hmm.
Okay. And 1.5 is for African Americans. And I think Indian Americans, South Asian are usually more prone to heart disease. So I would tell them also to aim for the 1.5. And I think everyone should aim for less than 1.5 for optimal metabolic health.
Mm-hmm.
So if you see that your ratio is off and it's too high, the way to fix that is you're going to decrease your processed carbs and you're going to increase your healthy fats, including saturated fats. So decreasing the carbs, what you're going to do is you're going to drop your triglyceride number, and the increasing the healthy fats and saturated fats, you're going to increase the HDL. So this is where seeds, nuts, fatty fish, you want to really increase more. So that's how you fix a ratio. So this is something I think that we don't focus on in healthcare. I think we should start paying more attention to this versus, just I think we tend to really fixate on the LDL number a lot. And I think that's because there's a drug to treat and it's easy to write the prescription. But this ratio, it's harder to really address, but I'm trying to make it very simple. If you see that someone's ratio is off, you just write a simple prescription for the three simple steps. And then the other two labs, I think they're going to probably take a little while to catch on. I think the second one is fasting insulin. So fasting insulin is an extremely important test because fasting insulin rises long before fasting glucose does. Mm-hmm. So maybe an early warning sign for metabolic disease. And then optimal levels of fasting insulin are probably somewhere between 2 to 6. I don't know the exact units per ml, micromole per ml. So this is, again, what we talked about. When someone's insulin resistant, their fasting insulin will start rising, and it'll be up for 5 to 10 years before their glucose does. So we can actually catch all those pre-diabetics earlier. So we need to really, if we're focusing on metabolic health, we need to bring this lab test to the forefront. And that's what I'm trying to bring more awareness to the fasting insulin. And then the last one is hemoglobin A1C. We all know about that. You want to shoot for less than 5.5%, but some experts say that less than 5% is even better. So you want to be optimal, right? We don't want to just be in the normal range. We want to really go for the optimal numbers. Those are 3 lab tests to just check under the hood. Fasting insulin, you can ask your doctor. Some might not be aware of it, but if they don't order, that's fine. You can just get the other 2 lab work done. But I would really highly encourage everyone to just check under the hood. There are a lot of folks that are walking around, they look thin. Mm-hmm. They're characterized as one of the second speakers that we had was Dr. Robert Lustig, a great endocrinologist from UCSF. And he said we see a lot of trophy, thin on the outside, fat on the inside. So they're holding their fat around the organs, which is the worst kind. But you will never know that just looking at a patient. So I can't look at a patient and determine that they're metabolically healthy or not. So you really need to do the lab work.
Oh, okay, sounds good. And then moving into the how to reverse all this, I know you talk about how intermittent fasting can help kind of fix all these problems. If you want to dive into that.
Yeah, definitely. And this, again, I think the number 1 and number 3 steps are really the appreciated and utilized in healthcare, I think. And this is where I would say I would like to bring intermittent fasting to the forefront. And a lot of people are talking about it. A lot of people are doing this. When I started speaking about this, there were some staff members. They said, "Oh yeah, we're doing this." And I've talked to some patients. They're like, "Oh yeah, we do this all the time." So the word is getting out there, but I really want to bring it to the forefront. And this is where it is very powerful. So I would say the 6 small meals a day spread out. You gotta throw it out. It's big food marketing. It's there to sell the products that are in the middle of the supermarket. Okay, so most adults, what you need to do is to eat 2 good meals in an 8-hour window. So when I'm seeing someone right now in my clinic, I tell them intermittent fasting is very healthy, and if I want to have them started off, what I tell them is, what you're gonna do is for 1 to 2 months, you're gonna eat 3 good meals within a 12-hour window, and you're gonna cut out snacking in between. So no snacking. You can still have water, black tea, black coffee in between the meals, but just cut out snacking. I think we're constantly snacking throughout the day, everywhere. Food is abundant. It's everywhere. The break room you go to meetings, there's donuts and cookies. We really need to break that mold. This is the addiction, and the addiction is there because it's always around, right? So we need to break that habit. And I used to do the same thing a couple of years ago. I used to go to the break room. Oh, there's donuts. I'm just gonna have half a donut. I'm not gonna have the full. Look, hey, I'm just having half. But when you have the half, you're getting an insulin spike. You're ruining that the fasting. So you're actually promoting the insulin resistance. So now I actually stay away. I've been known to go into the break room sometimes, and I see a lot of cookies or something. I've been known to throw out stuff because you're not, when you bring something in for your colleagues, you're thinking you're helping them. It's actually not helping. You would do much better by not bringing them anything. That is the better way. But bringing in sweets, it's not going to help your colleagues at all. So after you do that, after 1 to 2 months, what you're going to do is you're going to take away 1 meal. You're going to take away breakfast or dinner, whatever is easier for you. Because when you're sleeping that 7 to 8 hours, you're fasted. So most people, it's easier just to skip breakfast. I know it's a little bit more beneficial skipping dinner, but whatever is easier for you, I usually skip breakfast now. Most of the time, I grab a black coffee in the morning and just keep drinking water. Stay hydrated when you're fasting. And then I usually eat like a nice lunch, and then within an 8-hour window, I try to get the second meal in. It's not always perfect. Sometimes I eat late. Sometimes I fall off the wagon on the weekend. That's okay. You don't have to. Intermittent fasting is so powerful. You're in control. You can do, even if you did this 1 day a week, you would be much better off than doing all 6 days or all 7 days doing 6 small meals. So this is the powerful part of intermittent fasting. And there's a great New England Journal of Medicine article from 2019. It's got 80 different references, and it's showing all these different applications of intermittent fasting. It's showing it can be used in obesity and diabetes. It can be used in cardiovascular disease. It can be utilized in cancer, neurodegenerative disorders, asthma, MS, and arthritis, and surgical and ischemic tissue injury. So this is where this powerful agent, it's free to use. Why aren't we prescribing more of this? We should really be prescribing more of this. And this is where, if anyone wanted to, this is where I was really lucky to get Dr. Jason Fung to come out and speak to the doctors in our area. Amazing speaker. He's got a lot of great content on YouTube. So I'd encourage, all the patients that I see, I encourage them. If you want to learn more, just follow some of his YouTube videos and you can learn. He really breaks down the subject very simply. And, it's really helped me a lot. I used to always be around like 155 to 160 weight. But, ever since I started doing this, I've lost about probably 10 pounds. But all of that weight loss has been from the belly area, from the visceral adipose tissue. I can feel it, you can feel. And before it was like, how do you get rid of that fat in the belly? It was very hard. And this is where I would say obesity is a hormonal, not a caloric imbalance. This is key to understanding. So the eat less and move more, it does not work. We've been giving the wrong message, and then when the patients go through it, they'll cut down the calories. Actually, their metabolism will slow down. They'll feel really cold and crappy. They'll lose a little weight, but as soon as they come off that calorie restriction, the weight comes back. So we've been giving the wrong message. So I would not blame any patient that we've told that message. The way to unlock your fat in your body, it's basically behind a fat freezer. The only way to get to that, Dr. Jason Fung explains it a lot better than me, but he says you have to get insulin low enough for long enough. And what is the time? It's about 12 hours. 12 hours is when you unlock your body's own fat freezer. So the 16-8, when you do that, the last 4 hours, you will be burning your own fat. You'll be utilizing your own body's fat. And it can be done safely by most people. We tend to, I think the message is out there. If you skip a meal, you're gonna faint. So this is the marketing for big food. Do not fall for the big food marketing. I'm hoping you'll listen to the healthcare marketing. And again, the stuff that I'm saying, I would tell everyone, do not trust. You have to verify everything. There's always, sad to say, there's always a hidden agenda. If someone's only pushing one type of diet, I would say run the other way. But these 3 simple steps, and I've done this. I'm a big Elon fan. I know he's a controversial guy, but he says, first principles thinking. You got to get to the root cause, and just getting to the root cause was all the problems that I was seeing. The root cause was the insulin resistance. So this is basically tackling the obesity and type 2 diabetes epidemic from first principles thinking. And you get a bonus of preventing dementia, and then it does reverse all of the other, high blood pressure. You can improve that with this abnormal cholesterol levels.
And cancer.
Oh, that was a little, and cancer. Yeah, sorry about that long rant.
No worries. That was good. Thank you for that information. I'll ask one last question, then if you want to go over the flyer, we can do that.
Okay.
Just a general question. As a physician yourself and taking care of patients, have you seen personal changes in your patients' lives from the 3 steps that we've talked about today?
Definitely. I started off beginning of this year by educating my radiology staff, all the technicians, the nurses, the front desk staff. So I started by educating them, and they've started doing this. They've found it very powerful. They're actually getting together, and as a group, they're doing fasting together. If you get a buddy that's at work, that's helping you out, and you're doing fasting at the same time, it's a lot easier. And then I've had people lose weight. One person, since the beginning of this year, they've lost 40 pounds with intermittent fasting. So if you want to lose weight, this is the way to do it. The patients, I haven't really gotten feedback because I usually see patients in mammography callback. I don't see that many routinely. So these are the patients, they've had a mammogram screening examination. We saw something on their scan and want to call them back, press it out and see if it was just overlapping breast tissue. And if it's benign, when they come back, that's when I give them, this is if it's someone that's coming back, everything is okay. I tell them everything's normal. Come back in a year for your next screening mammogram, and I want you to do these 3 simple steps for cancer prevention. So I've started advocating for these 3 steps. And then I've asked all the patients that I see now, I'm asking them, what kind of cooking oil are you using at home? And I would say about 90% say they're using olive oil and canola oil for frying. So they are using these vegetable oils for the high heat frying. But this is where I would say, use a better alternative. Avocado oil has a high heating point. Coconut oil you can fry in. The clarified butter has a high heating point also. And those patients, they haven't gotten back yet, but I'll probably start seeing some of those follow backs because I started doing this with the patients for like the last 2 to 3 months. But really great response, and the patients love hearing the message that they can actively do something for cancer prevention, which I think really empowers them.
Yeah, it does. And then just in addition to that, lately, past couple of months, I've been looking at like the ingredient labels of a lot of foods really closely, and a lot of the processed foods have all the seed oils in them. They're like, there's always canola oil, there's always sunflower oil, in every little thing, like in things I wouldn't even imagine have oil in them. It's wild.
And one of the most sad things is hummus. I love hummus, and sad to say, when I go to the big stores that I normally go, it's got the vegetable oil. So I guess I'm gonna have to start making hummus more at home. So this is it's just everywhere. And I think I saw something recently posted. There was frozen blueberries at one of the stores, and I don't know why they had vegetable oil in there. Why would you do that to blueberries? So yeah, just that's a great point. You should really start looking at the labels. Look at the labels. If it has vegetable oils or high fructose corn syrup and a lot of sugars, think twice.
Yeah, do think twice. But I'm surprised about the hummus. I thought it was olive oil normally.
That's what we would expect, but look at the label next time you go to get hummus, because I do love hummus.
Will do. Thank you for that. I'm going to share my screen now, and then you can go over it.
Yeah, perfect. So, basically what I do is I start showing, this is a trifold that my son, who's in college, helped me create for the 3 steps. So the bottom right is what I show my patients initially. Yeah, so I tell them the top 4 items you can reverse, and along with the non-alcoholic fatty liver disease and the PCOS, all those 6 are reversible. And at the bottom left, the cancer and dementia are preventable.
Okay.
So how can we do that? What is the root cause? So the top left, the root cause of poor metabolic health is insulin resistance, right? So it's spelled out right there. Elephant in the room. Let's make healthcare more aware of this. Insulin resistance is a problem. So if you go to the next page. Yeah. So this is where it's very simple, right? 3 simple steps. Avoid the processed seed vegetable oils, the 8 that we talked about, that you're going to try to avoid is right there, the hateful 8. Dr. Kate Shanahan, again, if you want to read some material. And at the bottom is the simple 6. You don't have to use all those 6, right? You pick according to your dietary choices. I like the butter and the ghee we use personally. And then we have some avocado and olive oil at home as well. Second step, eat a diet low in processed carbs and sugars that uses healthy sources of fat. Again, CDC is telling us Americans are eating and drinking too many added sugars. We need to listen to the CDC, right? And then the graph right there, I want this to be imprinted in everyone's head, okay? Everyone needs to think of this graph whenever they go to eat something next time. So the left axis is the blood insulin response. And then the yellow peak is from carbohydrates. And then the middle one is protein. And then again, the bottom is fat. So we should really be eating more healthy fats if we're trying to reverse insulin resistance. So I'm here in healthcare now, marketing and telling people, do not fear healthy fats. They are good for you. Add more healthy fats to your meal, cut down the carbs. And then if you're going to eat yogurt, get the full fat yogurt, right? Because usually the low fat yogurt is going to have a lot of added sugars to it. And then on the bottom is the really simple grocery store. You're going to stick to the outside, eat the real food. Stuff in the middle, 90 to 95% are addictive substances. Try to cut those down, right? We don't have to go to 0, but let's get off that 70% ultra processed foods that we're eating. And then the last step is the practice intermittent fasting, built on solid foundation of time restricted eating. And that's how I describe, I showed you how to build that time restricted eating. And this is where the 6 small meals a day, not good. You're gonna promote insulin resistance that way. Mm-hmm. And then the bottom is the 8-hour eating window, no snacking in between, and then drink water, black coffee, black tea while you are fasting. And then if you have a lot of insulin resistance and you want to lose weight, you can start closing that window. You can close it to 6 hours, then you can do 4 hours, 2 good meals, and then you can even do 1 meal a day. And this is where keep learning about intermittent fasting, a lot of proven benefits. 24 hours is when autophagy begins in our bodies. And the Nobel Prize in 2016 was won for autophagy. I forgot the scientist's name. So that's when your body goes around and clears up damaged cells in the body. And if you can go to 36 hours, you increase autophagy by 300%. So I would say once a year, everyone should try to do, the adults should try to do 36-hour fast. And then just throw in quick precautions for fasting. Who should not fast? Pregnant and breastfeeding. Women should not fast. Women trying to get pregnant. Kids, I would not advocate fasting. Use the first 2 steps and cut out snacks for kids if they're wanting to get in shape. Anyone who is underweight or malnourished should not fast. Anyone with a history of eating disorders such as anorexia or bulimia should not fast. And anyone taking medications that lower blood sugar should not fast. So these are the precautions, but majority of us adults are able to safely fast up to that 36 hours. And I would recommend maybe once a year trying to do that to kick in autophagy, clear up those damaged cells, and be really healthy. I've done a few 24-hour fasts, and I'm working my way up towards the 36 hours. So again, slowly build up to it. No diving deep fast, and you're in control when you do this. So that's the beauty about intermittent fasting.
Well, thank you, Dr. Bhasin, for giving this informative talk. I hope a lot of people learn from this. I know I've heard you 3 times now, and every time I hear you, there's always something new I learn, and I always take some notes.
Oh, that's great.
Thank you for joining this, and a big thank you from everyone watching for all the information you've given.
Thanks again for having me, and getting the healthcare marketing out there for me. I need more venues, so I'm looking forward to doing more of these interviews. So, but reach out with any questions and stuff. And thanks again.
Thank you, Dr. Bhasin. Bye-bye.